You have done everything your doctor told you to do. You cut the salt. You take the pills every single morning. You walk. You watch your weight. And yet, you are still dizzy. Still lightheaded when you stand up too fast. Still exhausted by noon for no reason you can explain. You have mentioned it at appointments, maybe more than once. And every time, you hear the same thing. That is just part of getting older. That is normal at your age. It will pass. Let me tell you something I tell my patients every single week. That dizziness is not just getting older. It is your body sending you a signal. And the signal is not that you need more medication. It might be that you need less. Because what I am about to share with you today, based on the latest guidelines from the American Heart Association, could change your prescription before the end of this week. I am Dr. Richard James. I have spent over 3 decades in clinical practice, specializing in senior health. And I need to explain something that the medical community has quietly admitted, something that affects millions of seniors taking blood pressure medication right now. For decades, the standard advice was simple. Lower is better. Push that number down. Take the pills. Do not miss a dose. And for most of that time, nobody questioned it. If you were over 65 and your blood pressure was elevated, you got a prescription. End of conversation. But in 2025, the American Heart Association and the American College of Cardiology released updated guidelines that say something very different. And if you are over 65, you need to hear this. Here is the number: 11.4%. That is how many older adults with stage 1 hypertension were reclassified under the new guidelines as no longer needing the medication they were prescribed. According to a study published in the Annals of Internal Medicine in 2026, when researchers applied the new Prevent Risk Calculator to adults aged 65 to 79, 11.4% of those previously eligible for blood pressure drugs no longer qualified for treatment. Applied to the senior population, that translates to hundreds of thousands of people taking pills every single day that they may not need. Pills that could be quietly doing more harm than good. And the consequences of that are not mild. We are talking about dizziness, falls, broken hips, and for some seniors, a one-way trip to a hospital bed. In the next few minutes, I am going to walk you through exactly what changed in these guidelines, why it matters specifically after 65, and the precise conversation you need to have with your doctor. But first, you need to understand what is actually happening inside your body when your blood pressure drops too low, because that part, almost nobody explains it. There is a medical term for what you might be feeling. It is called orthostatic hypotension, and in plain language, it means your blood pressure is dropping so low when you stand up that your brain is not getting the blood it needs. Think about what happens every time you get out of bed in the morning. You swing your legs over, you stand up, and for just a moment, the world tilts. You reach for the nightstand, maybe you grab the wall, and then it passes. You tell yourself it is nothing, just getting older, just a head rush. But it is not just mornings. It happens when you get up from the couch after watching television. It happens when you stand too quickly at the dinner table. Some of you feel it in the middle of the night when you walk to the bathroom. That heaviness in your head. That moment where you are not sure your legs will hold you. You have learned to move slowly. You have learned to hold on to things. And you have learned not to talk about it because you think it is just what happens when you get older. But that is not nothing. That moment, those 2 or 3 seconds of dizziness, is your brain being starved of oxygen. Your blood pressure is supposed to adjust when you stand. Your heart should pump harder, your blood vessels should tighten, and the blood should keep flowing upward to your brain. But when medication pushes your pressure too low, that adjustment system cannot keep up. The blood pools in your legs, your brain gets less, and you feel it every single time you stand. Here is why this matters more after 65. As you age, your blood vessels lose elasticity. They get stiffer. That means the system that adjusts your blood pressure when you change position already works less efficiently than it did at 40 or 50. Now add medication on top of that. Medication that is actively pushing your numbers lower, and you have a system that is being squeezed from both sides. Age is weakening it. Your pills are overloading it. I had a patient. I will call her Margaret, 72 years old. She came into my office because she had almost fallen in her kitchen, twice in 1 week. Same story both times. She stood up from the table, reached for her coffee mug, and the room started spinning. She caught herself on the counter. Barely. Margaret had been on the same blood pressure medication for 8 years. Nobody had rechecked whether she still needed that dose. Her reading in my office that day was 102/58. That is dangerously low for a 72-year-old woman. Her heart was fine. Her lungs were fine. Her medication was the problem. We adjusted her dose. Within 2 weeks, the dizziness stopped. Within a month, she told me she felt like a different person. She had been living with this for years and just assumed it was her body giving out. It was not. It was her prescription. And here is what keeps me up at night. Margaret is not unusual. She is typical. Across the country, there are seniors sitting in kitchens and bathrooms and hallways right now, grabbing counters and door frames to keep themselves upright, and blaming it on age. It is not age. It is a medication dose that was set years ago for a risk profile that no longer applies to them. Now you know what is happening inside your body. But here is where it gets really concerning. Because the new guidelines did not just identify the problem, they put a number on it. And that number is bigger than anyone expected. For decades, the medical world relied on something called the pooled cohort equations to decide who needs blood pressure medication and how aggressively to treat them. This was the formula. Plug in your age, your cholesterol, your blood pressure, and out comes a number that tells your doctor how likely you are to have a heart attack or stroke in the next 10 years. If that number crossed a certain threshold, you got the prescription. The problem is that the formula was wrong. Not slightly off, wrong by a factor of 2. According to research published in Circulation in January 2024, the old pooled cohort equations overestimated cardiovascular risk by approximately 2-fold. That means for years, the calculator your doctor relied on was telling them you were twice as likely to have a heart event as you actually were. And based on that inflated number, millions of seniors were put on medications or kept on dosages they may not have needed. Think about that for a second. The math that determined whether you got a pill every morning was doubling your actual risk. Not by a little, by 100%. The new PREVENT equations, developed by the American Heart Association, using data from over 3 million diverse adults, changed the calculation entirely. They added kidney function. They added metabolic health markers. They removed race as a variable and replaced it with more clinically relevant factors. They included real-world outcome data that the old model completely ignored. And when researchers applied these updated equations to older adults aged 65 to 79, the conclusion was unavoidable. 11.4% of those with stage 1 hypertension no longer qualified for the medication they had been prescribed. 11.4% may sound like a small number on paper. It is not small when you are the one taking a pill every morning that is making you dizzy. It is not small when that dizziness leads to a fall. And it is not small when that fall breaks your hip. The reason this matters right now is that the 2025 guidelines officially replace the old risk calculator with the PREVENT equations. Your doctor may still be using your old risk score. Your prescription may still be based on outdated math. And until someone recalculates your actual risk using the new framework, you could be taking a dose that no longer matches your body. So now you know the guidelines changed. You know 11.4% of seniors with stage 1 hypertension were reclassified? But here is the question nobody is answering. What happens to your body when your blood pressure stays too low for too long? Because the consequences go far beyond dizziness. And this is the part that should genuinely concern you. Here is the chain of events that keeps me awake at night. Your blood pressure medication pushes your number below where it should be. You stand up in the morning. Your brain does not get enough blood for 2 seconds. You reach for the counter. You miss. You fall. And after 65, a fall is not just a fall. It is a medical event. Your bones are not what they were at 40. Your reflexes are not what they were at 50. And your body's ability to recover from impact has changed in ways you cannot see on the outside. A fall that a younger person walks away from can put a senior in a hospital for weeks. Falls are the leading cause of injury-related death in adults over 65. According to the CDC, in 2024 alone, over 43,000 adults 65 and older died as a result of falls. That is not a typo. 43,000 people. And the fall death rate in this age group has been climbing for years. increasing by 21% between 2018 and 2024. Now think about hip fractures specifically. Nearly 319,000 older adults are hospitalized for hip fractures every year in the United States. And the CDC reports that 95% of those hip fractures are caused by falls. The research on what happens after a hip fracture is staggering. A systematic review published in the World Journal of Orthopedics found that the average one-year mortality rate after a hip fracture is approximately 22%. That means roughly 1 in 5 seniors who break a hip do not survive the following year. Not because of the fracture itself, but because of the cascade that follows. Immobility, infections, blood clots, pneumonia, loss of muscle, loss of independence. Fewer than half of survivors regain their previous level of function. So follow the chain. A blood pressure medication set too aggressively pushes your numbers too low. Low blood pressure causes dizziness when you stand. Dizziness causes a fall. A fall at 72 is not the same as a fall at 32. And a broken hip at 72 can be the beginning of a sequence that ends in a hospital bed, or worse. The medication that was prescribed to protect your heart may be the very thing that takes away your independence. That is not fear-mongering. That is what the latest research is trying to prevent. Now, I did not share all of this to scare you. I shared it because there is something you can do about it, starting this week. And in the next few minutes, I am going to give you the exact protocol, the specific steps, and the exact words to say to your doctor. But first, I know some of you are thinking something right now. You are thinking, my doctor would have told me if my dose was wrong. And I understand that. Your doctor is not the problem here. The guidelines are what changed. And most doctors managing hundreds of patients have not had the chance to sit down and reassess every single patient's numbers against the new risk framework yet. This is not about blaming your doctor. This is about starting a conversation with better information. And let me be absolutely clear about something. Do not stop taking your blood pressure medication because of this video. That is not what I am asking you to do. Stopping blood pressure medication abruptly can be dangerous. What I am asking you to do is have a very specific conversation. And I am about to give you the exact words. I also know some of you are thinking, but high blood pressure is dangerous. Is not lower always safer? No, it is not. The data now shows there is a sweet spot. And for 11.4% of older adults with stage 1 hypertension, the current target overshoots it. Too high is dangerous, but too low is dangerous too. And nobody talks about the too low side. So here is exactly what I want you to do. This is the protocol I give my own patients, and I want you to follow it this week. Step 1. Sit down in a chair, rest for 5 minutes. Do not talk, do not look at your phone, just sit quietly. Then take your blood pressure, write the number down. Do this 3 mornings in a row, same arm, same chair, same time of day. Step 2. After you take your reading sitting down, stand up. Wait 1 minute. Take it again while standing. Write that number down next to the first one. If that top number, the systolic number, drops by more than 20 points from sitting to standing, that is a red flag. That is your body telling you something important. Step 3. And this is the most important part. Bring those 6 numbers, 3 sitting, 3 standing, to your next doctor's appointment and say these exact words. I have been reading about the 2025 AHA-ACC guidelines and the new Prevent Risk Calculator. My home readings are showing a significant drop when I stand. Can we review whether my current dose is still appropriate for my actual cardiovascular risk? Step 4. Ask your doctor specifically. Based on the new Prevent equations, would I still qualify for this medication at this dose? That conversation could change your prescription. It could stop the dizziness. It could prevent the fall that has not happened yet. And it starts with 6 numbers on a piece of paper. Your body has been trying to tell you something. The dizziness, the lightheadedness, the fatigue you have been blaming on age. Those were not just symptoms. They were signals. And now you know what they mean and exactly what to do about it. You did not cause this. You followed the advice. You took the pills. You trusted the system. And the system's math was wrong. But now you have better information. And better information means better conversations with your doctor. That is how you take back control. If someone you care about, a parent, a spouse, a friend, is over 65 and takes blood pressure medication, please share this video with them. You could be the reason they have the right conversation with their doctor this week. You could be the reason they do not fall. I am Dr. Richard James, and if you found this helpful, subscribe, because next week I am covering what the latest research says about cholesterol medications after 65, and that one is going to surprise you. Take care of yourself this week. You have earned it.